Hi, I'm Dr. Jeff Nelson from Freedom Healthcare, and today I'm going to talk a little bit about low testosterone, known as hypogonadism, and how that works, and the treatment options for low testosterone. So when a guy comes into me complaining of low testosterone symptoms, they often have loss of motivation, poor healing and recovery from exercise. They just don't feel as good as they used to. Their mood, their energy, their enjoyment of life. And oftentimes they'll also be erectile dysfunction or loss of libido. All this is kind of driven by testosterone, and testosterone has a myriad of benefits in us that are long-term health and wellness benefits as well. But let's talk about kind of how it's diagnosed and then the treatment options for it. The official diagnosis of low testosterone is 2 morning testosterone labs that are off the chart low, below the low end of normal. But one thing to consider is that the normal range is normal range for all 18 to 100-year-old men. And so there's plenty of men who come in and they absolute symptomatic low testosterone, yet they still fall within that normal range just barely. Those guys deserve to be addressed just as well as those who fall off the normal range. Because that could be a spread of just 5 points, for example. Someone's just barely off the low end, or someone's just barely on it, and then therefore they don't qualify. But that's not the case. They all should qualify. So low testosterone is not just a diagnosis of a lab level, but also listening to the patient. What is the patient experiencing? All the symptoms that are involved, okay? So let's talk a little bit about how testosterone works. This is the brain, that's the pituitary gland. The pituitary communicates with the testicles through luteinizing hormone, which then tells the testicles to make testosterone. And then the brain will monitor the levels of testosterone. And another thing that's really important to consider is what our body does with testosterone. Most of the health benefits of testosterone actually come from the conversion of testosterone to estradiol. Men's bodies need estradiol. We have it our whole life whenever we have a good testosterone level. And estradiol is what lowers cholesterol, reduces blood pressure, reduces Alzheimer's, improves cognitive function, improves bone density. It kills prostate cancer. And so estradiol is a lot of the health and wellness benefits. Testosterone also gets converted to dihydrotestosterone. Dihydrotestosterone is the potent testosterone that goes around in our bodies and improves our enjoyment of life, our energy, our exercise tolerance, recovery, and just our overall well-being, okay? And unfortunately, some men are genetically sensitive to the dihydrotestosterone, which causes male pattern baldness. And but then our brain monitors this, and when we're young, if our testosterone drops, our brain will say, increase the luteinizing hormone and correct the problem. But as we get older and as our testicles age, our testosterone levels just go down, and the brain, interestingly, doesn't react. The brain says, come on, I'm 45, I'm 55, that's all I got. And so that's when overall levels of testosterone go down. So let's talk about testosterone replacement, or not replacement, but supplementation. Testosterone supplementation is taking testosterone and putting it on or in a patient, either through topical creams. You've heard of things like androgel. There's also compounded creams. There's testosterone pellets. That happens to be the most expensive way, but it's very effective. It's natural testosterone pellets that go underneath the skin and need to be replaced or redone every about 4.5 months is the average, 4.5 to 6 months. Usually most guys need it about every 4.5 to 5. There's also testosterone injections that can be self-administered as long as you're taught properly by your medical provider. And those can be intramuscular or even subcutaneous injections. Now, when we put testosterone back in us, our brain will monitor that and say, oh, I've got enough, and it can lower the luteinizing hormone, which can result in decreased sperm production and possibly slightly decrease in the size of the testicles. Most guys that have symptoms of low testosterone are already beyond the point in their life where they want to have more kids, so they're like, that's fine. But if that becomes a problem, or if I have plenty of patients who are younger who have off the chart low testosterone and I need to replace it or supplement it, and yet then that makes it so they have no sperm count, and then they want to have children. And so the treatment there is something that most people have heard of, Clomid. Clomid, also known as clomiphene, stimulates the pituitary gland to raise LH and therefore increase sperm count and maintain testicular function. And so Clomid has been used for decades for infertility in both men and women. In women, it causes the ovaries to make more eggs, and that should always be monitored by a fertility specialist so you don't end up having triplets or quintuplets or whatever. But Clomid in men is used for sperm production. Another way to treat this side is HCG. And a lot of people have heard of HCG. That's called human chorionic gonadotropin. It's actually a subunit of LH. And HCG is a little more difficult to use and a little more expensive. It has to be injected subcutaneous every day to 3 times a week for efficacy. And HCG is just a subcutaneous injection anywhere under the skin, and it directly acts on the testicles to increase sperm count and maintain testicular function. Now, both of these will actually stimulate a little bit of testosterone production on their own, but not usually enough to get the levels to an adequate level. So most men who take testosterone are doing some form of testosterone supplementation, and some who need to maintain testicular function or sperm count will do Clomid or HCG as well.